Over 10 million Americans have osteoporosis, with millions more at risk. As we learned from Dr. Mim-Mulford of Mission Hospital, with early detection, osteoporosis can be controlled and bones can be strengthened.
It's a natural process of aging. There are other things that accelerate it, but we usually pick it up in the postmenopausal age, and that has to do with lack of estrogen for women. And it causes there to be a dysregulation in bone formation and bone breakdown. So that you continue to have bone breakdown, but there's no bone building going on. You don't have pain, you don't have any symptoms unless you have a fracture. So we encourage patients, number one, to think of it as a pediatric disease where you need to build your bone, because you reach your peak bone mass at age 30. So anything after that is downhill. So if you reach a higher peak bone mass, you're less likely to fall into the osteoporotic range or osteopenic range as you age. Fractures are most likely to occur in the spine, and that's because the spine has a different kind of bone than your hip or your arm, and it's more fragile and more susceptible to fracture. It causes the most pain in our elderly population, but does not require the most hospitalization. Hip fracture is what's going to require you to be hospitalized, mostly because of practicality. You can't walk with a hip fracture. There's also more mortality with the hip fracture. Here at Mission, in our office, we have a bone density machine, which is a large X-ray machine which measures the density in your spine, your hip, and your arm. So we can assess how you compare to people your age and also to young, healthy people, which is what assesses your fracture risk. There are other devices which are very readily available, sometimes in pharmacies or grocery stores. They'll have ultrasound of the heel techniques, which is a nice screening and easy way to do it. So sometimes people will come to us with abnormal ultrasound screenings, and then we'll go ahead and do the full bone density. There are medicines and treatments available to help build bone. So you will always have the diagnosis once you have it, but you can prevent any further loss, and you can actually build bone. Recently we have injectable parathyroid hormone, which is a new way that we use to treat the patients that have not responded to routine therapy, and that's been a big breakthrough. I'd recommend, if it were my teenage daughter, is a healthy lifestyle in terms of exercise, minimum 3 to 4 times a week, multiple daily dairy products, servings, or a calcium supplement, avoiding the sodas which leach the calcium out of the bones, trying to avoid excessive alcohol intake or smoking, and I guess just yearly checkups for any symptoms that are out of the realm of norm. Hyperthyroidism can cause excessive bone loss. Patients who are on certain medicines like prednisone or seizure medicines can have accelerated bone loss. So mostly prevention, and then follow-up to exclude any other compounding factors.